Greetings, Centenary. You may or may not know me. I'm Daphne Byers, a member since 1992. I have been a registered nurse for 28 years. Centenary should be proud to say we are celebrating our 113th anniversary, 113 years of service to our faith, family, and communities. Our theme this year comes from Jeremiah 29:11. For I know the plans I have for you, declares the Lord. Plans to prosper you and not harm you. Plans to give you hope and a future. I have accepted a position on a health committee with Reverend Troy in conjunction with OSU Wexner Medical Center. I believe and feel that health has to be a part of Centenary's plan, not just spiritual, but physical health. So together we will make positive changes in our lives one step at a time. Currently, I work in cardiovascular services, and it has become my passion. My first initiative I would like to introduce to the congregation is Women and Cardiovascular Health. It's the #1 killer of women in the United States and 3 times higher in African American women. In February of 2014, I will be having a heart health fair and red style show. There will be a great deal of information, there will be screenings, and to top it off, there will be speakers from the Ross Heart Hospital, along with models that have survived downfalls in cardiovascular incidents. I hope all ladies in the congregation look forward to this event, and I would like to introduce to you a cardiologist in the OSU Health System. Her name is Dr. Ruchika Husa.
Hi, my name is Dr. Ruchika Husa. I'm a cardiologist at The Ohio State University. It is my pleasure to speak to you about women and heart disease. I, as a daily practice, treat many men and women with heart disease, and I have noticed many similarities and dissimilarities between the two, which I would love to highlight today in my talk. First of all, let's get this clear. Heart disease is considered a man's disease, but it's no longer the case. I see and treat many women with heart disease. In fact, heart disease is the #1 killer amongst women and is more deadly amongst women than all forms of cancer combined. For example, breast cancer is responsible for 1 death in 31 women, whereas heart disease is responsible for 1 in 3 deaths in women. More and more, we are realizing that heart disease is a real and treatable condition in women, and which is why I would love to educate you today about the symptoms of heart disease, the prevention of heart disease, and lastly, the treatment of heart disease. After taking care of many women with heart disease over the years, I have realized that women are quick to seek care for the men in their family with heart disease, but often delay their own care. So, women with heart attacks tend to present later to the emergency department. They tend to present later to their primary care doctors with daily symptoms and hence receive care later. Women with heart attacks also present differently. We're used to seeing TV commercials in which a man is having a heart attack and he presents with the typical chest pain. Women tend to present more atypically, in which their symptoms of heart disease may be shortness of breath, nausea, stomach pain, sweatiness, arm pain, or jaw pain. If you are having any of these symptoms, especially with exertion, you should seek care to be diagnosed for heart disease. The other things we would like to highlight are the reasons for heart disease, i.e. risk factors. So risk factors for heart disease include smoking, weight gain, with obesity being an epidemic now in the United States. Also, sedentary lifestyle is a big risk factor for heart disease, untreated high blood pressure, diabetes, and high cholesterol. All these risk factors can potentially be treated and modified, hence reducing your risk of getting heart disease. The American Heart Association has many recommendations now, specifically for women, to reduce your risk for heart disease. These include some of the obvious that you may already know, including blood pressure control, control of diabetes, also quitting smoking, and getting your cholesterol checked on a regular basis. But some of the other risk factors that can be controlled by you are getting 30 minutes of exercise a day. Exercise doesn't necessarily need to be a sprint. It just can be a walk with your friend in the park for 30 minutes. The other risk factor for heart disease also, especially in women, is a lot of psychological stress. That can be also counterbalanced with meditation or with regular exercise or receiving psychiatric or psychological therapy as needed. Treatment for heart disease is multifactorial. So one of the first steps for treating heart disease is obviously reducing your risk for heart disease. For those patients who already have documented heart disease, we like to follow you closely to closely manage your blood pressure, to closely manage your diabetes and other risk factors, but we also check your heart function regularly to see that the heart ejection fraction, the way we describe it, which is the actual pump function of the heart, is working well. We may do a stress test to diagnose coronary artery disease, i.e. blockages in the arteries of your heart. We also may do other tests like cardiac MRIs to see whether you could have another reason to have heart disease. If I could just urge you to be open and understanding of the risk factors that you may have of heart disease and also of the atypical symptoms that you may be presenting with heart disease, then I think my work here today has begun excellently. So, symptoms of heart disease, once again to reiterate amongst the women, include shortness of breath, diaphoresis, which is basically sweatiness with exercise, jaw pain, arm pain, epigastric pain, which is stomach pain, or nausea. If you're getting any of these regular symptoms, especially with exertion, then you should seek care. Treatment for heart disease has included cholesterol medications, which are statins. The risk profile of using statins is much, much less than the benefits you get from statin therapy. There is also aspirin, which is a tried and true friend when it comes to us cardiologists. And then there are other blood pressure medications that we use regularly. If you feel like you are having a heart attack based on the symptoms that I had described before, you should not delay in seeking care. You should call 911, take aspirin, and be seen immediately for it. We would love to see you at Ohio State and treat you for any symptoms, risk factors, or further indications for heart disease. It was my pleasure to speak to you today. Thank you.